we have a couple new people in the group. I'm going to expand a little bit on, I'm one of the probably rare people in this group that I don't own my own business. I'm a practitioner in someone else's business, but I do run my own schedule. So I wanted to talk a little bit about some of the other people in my office so that I can kind of give them a little prize also, and hopefully it better explains a couple different other types of physical therapy that we also offer that not necessarily I do myself. So here's a picture of us. We're a pretty small group, which is nice because people like to come in and feel like it's a cozy place. It's never really loud in there. There's maybe only one other person in the gym when you're working out. So if you're a self-conscious person, people like that atmosphere. So myself, and then there's Jen, Trisha, and Megan. So a little bit about each person. So Trisha was the one second from the right, and she's actually the owner of the practice. She has a doctorate from the University of Puget Sound. Prior to that, she was a massage therapist, and she spent a number of years doing massage therapy and then just felt like she couldn't reach enough people through that, so she decided to go back to school and get her doctorate. She's done a little bit of manual therapy, which I talked a lot about last time, but as a refresher for some of you, it's kind of what I specialize in, and a couple of the other people in the practice have a similar background, but basically, in the simplest forms, I think of manual therapy as it's sort of a biomechanical approach to physical therapy. And you would think every PT would do that, but like any profession, there's a lot of bad PT out there. So the way I think of it is I look at each joint and look at the mechanics and sort of the physics of how it should work and how it's not, and maybe failing your body, and whether that's in correlation to some muscle tension or imbalances that might be creating improper mechanics in the joint, and then how I can help other physical therapists in the group can help through hands-on techniques to sort of reset those mechanics and help those joints or muscles or other structures work to their optimal function. So Trisha has some training in that as well, and she feels that her background as a massage therapist helps her augment both her manual skills in the clinic with physical therapy and other hands-on techniques. The perfect referral for her is that she likes the PT failures. So other people that have gone to other clinics and just not had the success, or they've been there for like a year, which seems like an insane amount of time to be in PT. And she feels like she really likes the problem-solving aspect of that, and really looking at all aspects of the patient, and not just that they have shoulder pain, and breaking down the problem-solving aspect of that. So that's her favorite patient. Megan is probably the youngest PT in the group. She's from Florida, and so she got her doctorate at the University of Northern Florida. She is certified in women's health therapy, which is something I'll go into a little bit more, not my specialty, but theirs. She believes that treatment should be based on the individual and focused on their personal goals. So her perfect referral is a pre- or postpartum mom. Going back to her women's health, which I'll talk about in the next slide. She enjoys educating them on the changes that their body's going through, how to stay active through those changes, and then protecting their bodies both before and after in their activities and with their new lifestyle afterwards. So a little bit about women's health. It can be kind of an uncomfortable subject. I don't even like talking about it, but they're both fantastic, both Trisha and Megan. And I think it's a really important subject, especially for new moms, and hopefully I never need their care. But, so the pelvic floor is a layer of 21 different muscles. So as I said at the bottom, it's not just how to do Kegels, it's so much more than that. So what they both specialize in is they do some internal work, which seems scary, but I've actually treated a couple of their patients, and you'd be amazed how long some of these postpartum women stay in pain, not knowing that there's resources out there. So there's some really great pelvic floor physical therapists. They do some work. So like any muscle in the body, it can become imbalanced, or it's too tight on one side, or you have scar tissue, or just everything's too loose after having a baby. And so they really focus on coming up with individual plans, and this is where it really does become individual. There's so much intricacy in those 21 muscles. I mean, it's like an area this large, with 21 muscles. So they help people with incontinence, pelvic floor pain, low back pain, tailbone pain, which can often confuse people because they think that, oh, that's my spine, but it might be just a tiny little muscle imbalance that's pulling it to the one side. Also organ prolapse, adhesions, and infertility, and they're both really great at that. So anyone that you guys know that women that are complaining of pelvic pain, and it can be even things as, you know, as hard as I talked about in one of my commercials, you know, like not being able to hold going to the bathroom. It can be like the most gratifying physical therapy. So Jen and myself are probably the most similar. She has a master's. She also has manual therapy training. She helps teach a class at the UW to the PT program there. She feels her greatest role as a physical therapy is empowering her patients to reach their goals, whether that's just getting out of the chair, walking a dog, running a marathon. She also loves working with postpartum women as she's a mom herself. So that's a good referral for her. So then a couple slides about me, things I've talked about before, but I have a doctorate from the University of Washington, and I did a residency and fellowship in manual therapy. So my perfect patients and the people I love working with most are like a young to middle-aged athletic population. And kind of like I talked about with the manual therapy is looking at the biomechanics. I really love the physics of how the body works. A little bit about our business. So we do hour-long treatments, and this is unique to other places, one-to-one, no support staff. And one of the things I think is most important about this is a lot of times with insurance, you might only get 20 visits a year, and if you go to a place that only has a 30-minute session, you still only get 20 visits, but you'll get an hour worth of 20 visits with us, and we're not going to push you around to other support staff. It'll really be me and you, or Jen and you, for an hour, and that's priceless time. We also do have early morning and late evening appointments. Let's skip past that. So some about my caseload. I had this slide in my last presentation, and I know it's kind of a little bit confusing up there, but one thing that I really wanted to point out and thank all of you for some of the referrals that I've gotten is my male to female ratio has changed a little bit. I'm getting more male patients now, which is fun for me, but also my age bracket patients have changed. So my favorite people are those young to middle-aged people, and I've actually had about a 10% increase in that sort of 20 to 60 population and lowering of those older people. So I just wanted to thank you all for all the great referrals, and some of you that have even trusted me with your body and your injuries to help you to narrow my caseload a little bit down. So thank you. Lauren Esmailka, Life and Balance Physical Therapy.